Hi, everybody, and welcome. We're glad that you all are here. So again, this presentation is about heat stress and hydration and electrolyte balance for farm workers. And my name is Matt Solberg, and here at the National Center for Farmworker Health, I do employer engagement. So I try to reach out to agricultural employers, labor contractors, other people in the industry, and provide them with resources that they can provide to their workers. And I'll talk a little bit more about why that particular role is important in trying to prevent heat-related illnesses among farm workers. So I'll pass it to Bethany.
Hi, everyone. Thank you for joining us. We are so excited to be talking to you guys today about this. As an FYI, we are recording this in English and Spanish so that folks can refer back to it later. But just to know that if you do decide to come off mute to ask a question, that it will be recorded. It's also on Facebook. So just keep that in mind. We'd love to hear your voice, but in case you don't want that going live, I wanted to give folks a heads up about that. So my background is in occupational epidemiology. I've been doing research and organizing work with immigrant outdoor workers for about 13 years now. I really like this work, and I care a lot about heat because I live in Texas and it's very hot and it affects a lot of workers here. All right, go ahead, Matt. So a little bit about us before we dive in. Matt and I are both at the National Center for Farmworker Health. We're based in Texas, and kind of our core work is to support federally funded health centers and other organizations that serve farm workers, be it through social services or organizing work or legal services. And we support them by doing trainings like this, different sort of technical assistance activities, research, and diffusing funding whenever possible. We really take a broad approach to improving farm worker health. So we like to collaborate with lots of different types of folks, including employers, including different organizations, and including farm workers themselves. Go ahead. All right. So some parts of this training will be maybe what you've seen before, if you've done a training on heat-related illnesses before, but we also have some things that maybe you haven't seen that we have learned are really important, like talking to workers about electrolytes, talking to workers about masculinity and taking breaks, and some tough questions like that. So I'll go over kind of the more medical stuff in the first half, and then Matt will talk about some practical applications in the field during the second half. Again, if you have a question, feel free to put it in the chat. Matt and I can both speak English and Spanish. So feel free to drop it in, and we will monitor the chat to answer questions as soon as we can. Okay, so why talk about farm workers and the heat? Farm workers are the most likely to die from the heat as compared to workers in other industries. They're 35 times more likely to die from the heat. Men are 32 times more likely to die than women. Some of this is because of the industries that are high risk for these types of fatalities, and some of it may be due to some other issues that we'll talk about later. About a third of all heat-related fatalities in the US happen during the month of July. So it's great that you're listening to this webinar now, and we hope that you pass this information along to workers that you encounter. Another key thing to note is that most workers, when they have a heat-related illness, they get sick in the afternoon. And 71% of workers who die from heat exposure, they die on the day they get sick. And what that means is that these are really fast-moving emergencies, and we need to take action very quickly. So let's go ahead and dive into some of those more rapid emergencies. We'll talk about chronic stuff later, but we're going to start with the acute, more rapid issues. So first, what is heat stress? Let me silence my phone here. What is heat stress? People get this kind of mixed up and confused all the time. So heat stress is just what happens when your body has extra heat that it can't get rid of, right? Our bodies normally stay in a really small range between 97 and 99 degrees. So once our body is over 99 degrees, we're experiencing heat stress. We have extra heat, we can't get rid of it. And that can happen through a variety of ways. It can happen through exercise or a really hot environment. Now, there's a relationship between heat stress, dehydration, and heat-related illnesses. Those things often happen together, but they can each occur on their own as well. But we'll talk about this briefly. So a worker who starts their day off dehydrated, they're less able to tolerate the heat. That's often because they have a mineral imbalance, an electrolyte imbalance, and their body just isn't functioning at the sort of highest level that it needs to deal with the extra heat. Another sort of relationship that's happening is that workers who are actually acclimatized to the heat will sweat more, and they become more dehydrated, which makes them less able to tolerate the heat. It sounds kind of weird, but it's true. Workers who aren't acclimatized to the heat have their own set of circumstances that makes them susceptible to the heat. But I wanted to put this in here because a lot of times we meet workers and they say, I'm used to the heat. I don't need breaks. I don't need to drink as much water, but they're sweating a lot and they need to. Okay, Matt, go ahead. So these acute heat-related illnesses, there's phases that happen. And you can go ahead and go to the next slide. They kind of range from pretty mild to really severe. The only ones on the lower end that aren't that severe are two symptoms: heat rash and heat cramps. You can go ahead. Most of us have probably had those at some point in our life. And really the main thing to do for both of those is that the worker should rest in the shade or in an air-conditioned vehicle or some other cool area. They should drink water. Electrolyte solutions are great. We'll talk about that more later. And then if they have a heat rash, a change of dry clothing can help that heat rash not get worse or, not spread. Now, especially for heat cramps, if they have those, if they've been resting, they've been drinking water and they're still having heat cramps, they do need medical attention at that point if it's not going away. Go ahead. All right. Those are the only two things that aren't scary. Okay, the other things are a little scarier. So this is in the middle. This is like our moderate severity of heat-related illnesses. These include things like being dizzy or feeling lightheaded, having a headache, being nauseous or vomiting, being irritable or grumpy, not urinating as much, or being really thirsty. Fainting is also on this list, but I'm going to give you a caveat here on the next slide. This is where I found in the field, working with construction workers, landscapers, farm workers, when workers are having these symptoms, it's really hard to get them to go to the doctor. It's really hard to get an employer to let them go to the doctor, right? Because we get headaches for many reasons, and workers will blow this off. So this is where our training deviates a bit from the standard sort of advice. Any standard training is going to tell you that the worker needs medical attention if they have a headache, if they feel nauseous, etc. But I just don't think that's realistic. So the more realistic advice is that if a worker has just one of those symptoms, they should go to a cooler area. They should take off any unnecessary clothes. They should take off their shoes. They should be drinking small sips of water, and they absolutely should not be left alone. They should be with someone who can watch them, give them water, and make sure their symptoms aren't getting worse. Now, in general, it's better to be safe than sorry. If a worker has a combo of those things going on, if they have a headache and they're vomiting, that's bad. If they've fainted, I would always get them to go to the doctor no matter what. This gets put in the moderate level. I'm not too sure why, but if they fainted, that's not a good sign. And I would get them medical attention. If things get worse, if they have just a headache, but the headache is getting worse, I would work very hard to get them to go to medical attention. Okay. Again, if folks feel that it's mild, a mild headache, some mild nausea, you can rest, drink water, see if things get better. But if they get worse, if they get new symptoms, they need to go to the doctor. All right. Sorry, man. I'm probably reiterating too much. Okay, here's heat stroke. These things are an emergency always. They absolutely need to get to a hospital, not just to a clinic. These things are very bad if they happen. There's a great question from Fabian. Fabian, you are asking about the slides in Spanish. We are recording this in Spanish, but you're right. We need, please folks, write in the chat if you feel like having these slides in Spanish would be useful, and I can present that to our leadership and see about getting these slides translated. So let us know if that would be helpful for you. Okay, so the emergency situation. So if a worker is very confused, they maybe don't know where they are, they don't really understand what they're supposed to be doing, their behavior is getting weird, it's just unusual for that person, maybe they're very agitated, just something out of the norm for them. They might have slurred speech, they might lose consciousness. So not just fainting and coming to right away, but actually losing consciousness for a period of time. Or they've perhaps stopped sweating and their skin is dry and hot, or they're sweating very profusely, or they have a high body temperature. So if the farm has, you know, an oral thermometer or one of those forehead scanning thermometers, somebody's acting a little strange, you can take their temperature. You know, if you're seeing 102, 103, 104, 105, those are all really bad, and they need, that worker needs some emergency action. So if they have any of these symptoms, it can go from kind of okay to fatal in a very short window of time. So it's really critical to call 911 in that situation and to take action while you're waiting for the paramedics. So what you can do is get the worker to a cold area. It's not enough for them to just sit in an air-conditioned room. They need to either be immersed in cold water and supported so they won't drown. If they can't be immersed in cold water, they need ice packs, cold water rags on as much of their body as you can, and fan them really vigorously. Some produce farms will have like a cold box room for the produce. It would be good to sit with them in there as long as there's no risk of entrapment or something. So any of those options would be good. The goal is to get this person's body temperature lowered because their brain is cooking. That's why they're acting confused. That's why they're not able to make good decisions, is because their body temperature is just too high. So you want to lower it. Now, the thing to say about this is there's two other things that can look like a heat emergency. One is if the person has diabetes and their blood sugar drops, it can be a similar thing where the person's confused and stumbling, etc. Or if the person is inebriated or using a substance, it can look like that. If you don't know which one of those it is, take them to medical care. If you think they're drunk but don't know it, take them to medical care. You can save someone's life. It's not worth guessing about it. Okay, these are two sort of notes, because especially for my friends in more northern climates, they think, oh, we don't have 115-degree days like they do in Florida and Texas, we'll be okay. But really, lower temperatures are quite dangerous for workers as well. So in 2012 to 2016, the median heat index, so not even the temperature, but the heat index, what it feels like outside, was 91 degrees. That's pretty low. We've had fatalities on workplaces occur as low as 83 degrees, and the heat index was under 91 degrees in about half of fatalities. So that's really kind of eye-opening, honestly, that a lot of workers are dying when the temperature is only in the 80s. Go ahead, Matt. We don't get into a lot of risk factors in this presentation. A lot of heat stress presentations will talk about age and being overweight, etc. I personally don't like to get into those risk factors, because then workers start to think, well, I don't have these risk factors, so I'm not at risk for a heat-related illness, whereas really everybody can be at risk. So we don't get into that a lot, but I will say one thing about acclimatization. And I think it's really important for those of you who work with H2A guest workers, because H2A guest workers are coming quite rapidly often from a cooler, much cooler climate to a hot and humid climate, say in Florida or Georgia. And they are not used to working in the heat. So it's really important to advocate for those workers that they have preferably a week of working and building up to a full day of work. Maybe start with 2 hours, the next day 3 or 4, etc., because they're just not going to be that productive because they're not used to it, and they are at a really high risk in that window of getting quite sick if they're having to work too hard and their bodies are just not used to that level of heat and humidity. Okay. I'm going to share this brief story, and I'll say one thing on a personal note. I'm sure some of you have probably known workers that died a very preventable death from heat stress. I worked several years ago quite closely with a family whose son died at 24 years old because of a heat-related illness. And, you know, it was very devastating. He was very healthy. He didn't do drugs or alcohol. And he left behind a very young daughter. And I bring up his case because he actually was one of those cases where he was sick for a few days and it kind of built up, and he had communicated to his employer for several days that he felt bad, that he felt ill. And on the last day, he communicated that he felt ill and that he couldn't feel his hands anymore, which is a bit of an unusual symptom. But the employer made fun of him the whole time and told him that he wasn't man enough, that he just wasn't used to it, he couldn't handle the work, etc. And then at the end of the day, around 5 p.m., he passed out on the work site. And unfortunately, they called paramedics at that point and it was too late. So it's important for workers to know that you need quick action. Anyways, we'll talk about some more practical applications, but I wanted to share that story because it is important that workers support each other and get medical attention when they need to, so that you know, these things don't happen, because they are all 100% preventable. This other case that we have on here, the case of Cruz Beltran, is another good case study, a very sad one, but a good one, because Cruz was a very experienced farm worker. He actually lived in Arizona. He was accustomed to the heat, and he ended up dying in detasseling corn in Nebraska, where it was cooler. And in his case, he was left alone. So he passed out in a cornfield and no one was with him. They didn't have a buddy system, which Matt will talk about, and they didn't have any mechanism to check on workers throughout the workday. So they couldn't find him for over a day, I believe. So his case is another good case to share, especially with employers. All right, let's talk about hydration and electrolytes. This is really critical. And I have some questions for y'all. You can answer in the chat. So workers can be dehydrated and not have a heat-related illness. And we'll talk about why staying hydrated is so important in a minute. But I want you to look at these 3 urine samples. And do you think that any of these research participants who gave these samples, do you think that these guys were hydrated or dehydrated? Jesus, I'm going to answer your question in a moment, and Christiane, I'm going to answer yours too. But let me know. Okay, good. Yeah, I didn't number these like I have in the next slide, which would have been helpful, but okay, good. So this one right here on the left, the darker one. Thank you, Matt. I realized my pointer doesn't show on the screen. So that one, this worker was mildly dehydrated, okay? And it can be a little different for everybody, but I tested this one and this person had a mild level of dehydration. So drinking some water would have been good for this person. The one in the middle they're overhydrated. They were probably drinking too much water, which can sort of mess up your electrolyte balance. So that worker might want to cut back a little bit on how much water they were consuming. The one all the way to the right is pretty good. It's a straw color. We want to see pale yellow or a straw color, and I'll share a chart with you in a minute. Go ahead to the next slide. All right, these are different. Now, which of these do you think, 1, 2, or 3, or some combo, which of these do you think the worker was severely dehydrated? Folks are saying 2 and 3. Some folks are saying 3. All right. All 3 of these workers were severely dehydrated. So even just a darker yellow like this can also mean that a worker is very dehydrated and needs to drink water. These 2 are very concerning, and we'll talk a little bit more about this. This is beyond dehydration generally. Brown urine like this can be caused by a very small number of foods or medications. But when I see urine like this, it's usually more serious because it can indicate liver injury, kidney injury, or kidney issues in general, or a condition called rhabdomyolysis that I will mention in a moment. So you guys are good. Go ahead. Here's some urine color charts. I think photos are better, especially for workers. You guys are welcome to use those photos when you talk to workers, because I think it's just easier to interpret for your own urine. But this shows you basically, on the left-hand side, it shows you that the brown is bad. And then the vertical chart as well shows that brown is bad. So the other thing to mention here is that workers who have cloudy urine or foamy urine, that can sometimes be a urinary tract infection. That can happen when workers are very dehydrated. It can also be a symptom of chronic kidney disease. So if workers tell me that they have cloudy or foamy urine or dark brown urine, that is an automatic referral to get healthcare. I'm gonna pause for a moment and answer Jesus's question because it was really good. I'll say it, I think it was in Spanish, but I'll say it in English. So Jesus said, what can you do if an employee already noticed his supervisor that he's nauseous and dizzy, and the supervisor says that it's, probably nothing serious? These situations get tricky, and it's a lot of what Matt is going to talk about, but I think we have to, really focus on empowering workers and educating employers. And we want to work on it from both sides. We can educate employers, but if workers are still afraid to say anything, that's not good. If workers will speak up, but employers are retaliating, that's also not good. So I think a sort of that 2-prong approach is really critical. There was another question about if we can share any official guidelines from OSHA or otherwise that agricultural employers should be aware of. So there's a handful of states that have guidelines on this that employers have to follow. I think it's Colorado, California, Washington, maybe one other state. But otherwise, there's nothing that they have to follow. But there are a lot of resources that give them guidance, and we can share some of those in the follow-up email. Oregon. All right, Oregon is another one. Okay, so severe dehydration. Dehydration is not good, especially when it's chronic over time. There's more and more research coming out showing that this is really a big problem for outdoor workers. We need to do a lot more work in this area, but it's not looking good. So one thing that workers should be concerned about is if they're working hard and they're getting dehydrated day after day, this can cause an acute kidney injury. This mostly has been documented in marathon runners, actually, but we know that it's happening to outdoor workers as well. And they can get repeated acute kidney injuries, and that can later put them at risk for having chronic kidney disease. If that is not managed properly, that will end up with the worker on dialysis and them having kidney failure. It's we want to avoid that. Rhabdo or rhabdomyolysis. That one's probably hard to interpret. Rhabdo is a newer one that we're worried about. Again, this is seen in the military with Ironman athletes. But basically this is what happens when you are working so hard and you're so dehydrated that your muscle tissue starts to die. And sort of the waste of that gets into your blood and does a bunch of damage. And rhabdo can also damage your kidneys. So again, we need to do research in this area with farm workers. There's not much, but I've spoken to a lot of physicians that are worried about this, and it's kind of an emerging research area in Mexico and Central America. Okay. All right, workers staying hydrated. So we have a flyer. We'll share the link. It's in English and Spanish. And it gives workers real guidance, specific guidance on how much water they should be drinking when they're working outside in the heat. So workers should stop by drinking a liter of water or half a liter of water before starting work at least. And that's just a regular plastic water bottle. And then they'll need to drink around a liter an hour. This is going to vary with different workers. Some might be fine with just one bottle, which would be half a liter. Some guys might need more, like 2 or 3 liters, but they need to drink a lot of water. What I've seen workers do is workers will often drink 1 liter a day. That's not enough in the heat. They're getting really dehydrated doing that. So if they can at least drink 1 plastic bottle an hour, that's better. If they can drink 2 an hour, that's even better. Workers, Gatorade's kind of pricey. And honestly, it's not great because it has so much sugar. So watered down Gatorade is best, or just a homemade Gatorade or homemade suero. So you can add about 1/4 to a half teaspoon of salt, a tablespoon of sugar. You can put that in a liter of water, and that is a decent homemade Gatorade. If they are using Gatorade, it's best watered down to have 2 parts water, 1 part Gatorade. A note on salt. So I know a lot of farm workers have high blood pressure or other chronic conditions. And so it is a hard thing to talk about in terms of how much salt people need. But do remember that these guys, if they're working outside in the heat, they need salt. They're sweating a lot and they're losing a lot of salt. So if you work with a clinic, I think it's best to kind of work with a nutritionist to get better advice, especially for workers that have chronic conditions. We just caution against doing health education talks that broadly tell workers to cut way back on salt, because workers who don't even have high blood pressure will hear that and think they need to cut back on salt, and they can end up making themselves feel pretty bad because they're not taking in enough salt during the day. Another note, many of you probably know this, alcohol and caffeine will dehydrate you. So encourage workers to abstain as much as possible from those things during the hottest parts of the season, or at least on the days that they work. If they can avoid alcohol and caffeine, that's helpful. Electrolytes. So electrolytes are great, and you can do more than just the suero. Coconut water is really good. Coconut water actually has the same electrolyte balance as the human body, and it's a little pricey. It's not cheap, but again, if you're not drinking beer, you can swap it out for a coconut water or 2. There's also many foods that are really rich in electrolytes and are great to eat during the day, at the end of the day, like bananas, watermelon with tajin. That's a great electrolyte replacement. Avocado, queso fresco, other cheeses too, but queso fresco is good because it's got quite a bit of salt. And things like yogurt, caldo, bone broth, those are all really good. April, we will put the flyer link in the chat. I'll do that in just a moment. I know you're sharing this.
She was asking about your suero recipe, Bethany. I can go back a few slides if that's okay.
Yeah. And I think I think it's in the flyer, isn't it? I think we put it in there. Or at least about watering down Gatorade, maybe.
Yeah. Okay.
Yeah. So in Spanish, media cucharita de sal, una cuchara de azúcar por cada litro de agua.
And we can share this link with everybody at the end of the presentation as well, so that you all can access this. We want people to use this as much as possible.
Thank you, Dorothy, for adding that in there. Perfect. Yeah, we will share that info. All right, last medical thing, and then we'll talk about some practical applications. So I briefly touched on chronic health issues. We went over all the acute stuff, right? All these sort of stuff that happens quickly and can be treated quickly. But there is a growing concern about chronic effects of being dehydrated all the time and your body experiencing heat stress all the time. So one of those things that we don't go into a lot, we could do a whole 90-minute presentation about chronic kidney disease. But I just wanted to mention it here. So really, researchers not here, researchers in Nicaragua and Costa Rica and El Salvador have done a tremendous amount of research on this topic, because it started, I think, in Nicaragua and El Salvador, because in El Salvador, kidney disease has become the second leading killer of men, and they're pretty young. They're dying of kidney failure in their 30s and 40s, and so researchers have been looking at this issue for the past 20 years or so, and there is just a lot of evidence that's been accumulated that connects working really hard, being dehydrated every day, to developing chronic kidney disease. And these men often don't have high blood pressure, they don't have diabetes, which are the sort of the other main causes of kidney disease. And it's just, it's incredibly devastating, because kidney disease sneaks up on you. And if you're a young, healthy guy and you have an earlier stage of kidney disease, you're not going to notice. You're just not going to notice. There aren't going to be any effects until you get to where you need dialysis, pretty much. That's when you're going to start feeling some effects, like reduced urination and swelling and things like that. And once it's at that point, there's nothing you can do except get new kidneys. And obviously there's a lot of challenges with that, especially in this country. So there hasn't been a lot of research on this at all in the US. But personally, I'm very passionate about this issue and have talked to nephrologists in different parts of the country that have been seeing this largely in Mexican men who work outdoors, and they're coming to get emergency dialysis in their 30s and 40s, and nobody knows why. So it's a concerning thing. We don't have a lot of good info on it, but it certainly won't do any harm to stay hydrated, take breaks, and try and prevent heat-related illnesses to avoid getting sick right now and to avoid getting sick in the future. Go ahead. There's a few other things. Again, this research is really limited in this area, unfortunately, but there are some connections in research that show being chronically dehydrated could potentially increase your risk of diabetes and metabolic syndrome, which a lot of farm workers have. And metabolic syndrome is having a combination of high blood pressure, high blood sugar, high cholesterol, or abdominal obesity. So some combo of those things. Being dehydrated can increase your risk of that. And likewise, there's a limited amount of research that shows that there's a link between dehydration, heat stress, and obesity. And I think this is what many of us are seeing, but failing to really appropriately address among many farm worker communities, is that farm workers are burning a lot of calories, but we're blaming the food for workers being overweight or obese. That might be the case sometimes, but it may very well not be the case. It may be because of this link and this sort of chronic mineral and water imbalance in people's bodies that's making them more likely to become overweight or obese. And then the last thing here is increased risk of kidney stones. I am meeting more and more outdoor workers who are getting kidney stones very often. once a month or even more often. And that is so painful. It's really painful, and it's preventable. So this is another concerning thing that makes workers' lives really pretty miserable if they're getting regular kidney stones. All right, I'll pass it off to Matt.
Thank you, Bethany. Okay, so let's talk about prevention measures and what we, as I'm not sure who on the in this webinar, how much of the attendees, what the breakdown is, what we do, but I assume that all of us advocate for farm workers in some way. So I'm going to go over what we can do advocating to and talking to workers, but also advocating and talking to employers about this serious issue. Okay, so the prevention measures, and these are specifically in a field and in the agricultural operation. The first thing, the primary thing, is making water and shade easy to access. That's the emphasis here. And many of you all who have done farm worker outreach or who have visited farms in some way or another, you all have probably seen that oftentimes there's a water cooler somewhere by the trucks or where the cars are parked, but workers might be 100 or 200 yards away from that water cooler. And so yes, it's technically there, they technically have access to it, but in the heat of the moment, pun intended, in the heat of the moment, when they're going down the rows and they're trying to make their piece rate and harvest as much as possible, are people going to take a break and walk 100, 200 yards to go get water or to go sit under some shade? And so our recommendation here is, and we've seen successes with this, is that when it gets above a certain temperature, if it starts getting into the mid 90s, upper 90s, mandatory rest breaks are a really good idea and a really good way to make sure that workers are getting access to water and shade. A buddy system, I'm going to talk about what we mean by a buddy system and some specific examples and specific cases of what a buddy system can help with in a few slides. And training the employers. And when we talk about the employers, we mean everybody from crew leaders for the labor contractor, who might just be supervising 10 or 15 or 20 workers, all the way up to the president of the company or the farm owner. Everybody should be trained on recognizing the symptoms of a minor heat injury and when it starts getting worse, and they should have a plan in place. And so you all will notice that these prevention measures, they all have to do with the employer and having the employer or the crew supervisors or the labor contractors, having them care about this and want to help and change things a little bit. So we'll talk about that more in a minute. That's a challenging issue. So like we said, access to water, rest, and shade. How far do they have to walk? Are they going to lose pay if they stop to take a break? That's one of the issues we'll talk about, is piece rate pay. And then this last bullet, will workers be teased or retaliated against if they stop to rest or if they stop to drink water? This is a tricky thing to talk about or to try to change, because it comes down to culture, and oftentimes culture between, not necessarily between a worker and the employer, but between workers themselves. There might be a culture of not showing that you need a break, or being afraid that you might get made fun of or gossiped about by your fellow coworkers if you stop to take a break. So we're gonna talk about this in the discussion section at the end, but if people have any thoughts or experiences or questions, anything in their experience about talking to workers and the culture among farm workers, or even just among men in general. And obviously we're talking about female farm workers as well, but like Bethany mentioned at the beginning, men are 30 times more likely to die of a heat-related fatality than women are. And there are some other things that go into that, but so the evidence. what is some evidence that we've seen that back up the water and rest and shade are important? So this was a very interesting study from Nicaragua, where with sugarcane workers, and this study, it gave sugarcane workers camelback backpacks, which people might be familiar with them, but it's a backpack that has a water bottle, in it, and then it has a tube coming around. So it's basically a water backpack that you can wear and always have access to water. They also implemented frequent rest breaks that accounted to 25% of the total workday, which might sound radical. And then workers also received an improved machete to cut the cane. And the results of this study were really, really promising. Water intake increased among workers by 25%, which was really good. And so what happened when workers were drinking more water? Again, because they had access to this backpack, they really could take a sip of water whenever they wanted. So their water intake increased by 25%, and the symptoms of heat illness or heat stress decreased. They started urinating more, which is always a good sign. And you want to encourage workers to monitor their urine, but and then what happened with, and this is an important point for employers, because if you go to an employer and say, give your workers 25% of the day as break, the employer is going to laugh at you and call you crazy and call you, you don't know what you're talking about. This is we have to make money. This is a business, which is understandable. But the workers' productivity increased almost 50%. They went from harvesting 5 tons of sugarcane per day, and that's per worker, 5 tons to 7 tons after this intervention. So basically, what does that mean? You give workers more shade and more rest breaks and more access to water, their short-term productivity increases, and their long-term productivity and their health. Their short-term health and their short-term productivity increase, as well as the long-term. So the buddy system, I wanted to talk about this some more. The buddy system is exactly what it sounds like. It's workers are paired up, or they have someone who they kind of check in with throughout the season. And the importance of this is for 2 different scenarios or contexts. So the first one is knowing how people act, like having a buddy so that someone can recognize if you're not acting the way you normally do. And why is that important? Like Bethany mentioned in the beginning, the symptoms of heat stress, the beginning symptoms of heat stress are, or even in a major heat stroke, but some of the beginning symptoms might be people are acting tired, they're not acting like themselves, they're confused. And then symptoms when it starts becoming an emergency is when they're stumbling around, or they're dizzy, they're slurring their words. And so if people don't know each other, if people doesn't know someone well, they might think, oh, that person is, I don't know what's up with him today, or he might be drunk or something. But if there's a buddy system in place and people know each other, or know at least their partner well, then somebody will know, like, that's not normal. He's not usually like this, or something's wrong with him. He needs help, or he needs a break, or she needs a break. So the buddy system is important for that, for knowing behavior change in your partner, but then also for keeping track physically of where workers are in a field. And that's important in crops like a lot of tree fruit, so apples and pears and cherries. Workers, when they go in and harvesting that, a lot of times they can't see the other workers in their field, or they might be really far away from the closest person. Or in corn detasseling, for example, the example that Bethany talked about, the man Cruz Beltran, who died in a cornfield, a big reason why he died was because he was alone. He had a heat stroke, he collapsed, and nobody knew where he was. People didn't find him until several hours later. And so with a buddy system, that can be prevented by people constantly checking on where their partner is. And this last bullet, the row marking system, that's a way of that we've seen actually from Michigan. I think one of our partners in Michigan told us about this, that one farm used this to put a flag or some sort of marker at the end of each row that a worker was in. And so people knew at the end of the day, as a way to keep track of where workers were in a field if they were spread out, which is it's a promising way of keeping track of workers. Let me click on the chat here and see if there's any questions. So people talked about the piece rate. We're going to talk about that as one of the primary challenges, that they're paid by the pound. Piece rate pay, or contract pay, whatever you want to call it. But a lot of times workers, and most people know this, people are getting paid by how much they harvest, not by the hour. And so most pay structures disincentivize taking a break or going to sit down. And so again, what can we do to try to convince both the workers want to make as much money as possible, and the employers also want workers to work as much as possible and to harvest as much. But we can emphasize to go against this piece rate incentive to work as hard as possible, emphasizing that proper rest and hydration will actually make you more productive in the short term and in the long term. Okay, so some other issues or things to keep in mind when approaching workers about this topic. So key points for if you're giving an educational talk to workers, or if you're just interacting with someone one-on-one, but what are some of the kind of science-based tips that we can tell workers? Drink before you're thirsty. So like Bethany mentioned with the hydration and electrolyte tips and the flyer, in the morning, wake up, drink a glass, maybe 2 glasses of water right when you start your day. Continue to drink, try to drink, I forget what it was, Bethany, but between half a liter and a liter of water per hour. Eat foods that will replace electrolytes. And again, the natural whole foods like bananas, avocados, coconuts, cheese. Encouraging workers to check their urine color at all times of the day. And if it's consistently dark yellow or brown, or if it's consistently dark yellow, they need to drink more water. And if it's, at the end of the day, if it's really brown and if they're feeling very tired, they should consider going to the hospital. And a point on this, on talking to workers about urine and just giving health education talks in general, something that Bethany and I and a lot of our other colleagues here at National Center for Farmworker Health, this is something we do a lot, is popular education style talks. And this would be a good opportunity to kind of make a joke maybe with workers and somehow lighten the mood by acknowledging that looking at your own pee might be a little childish or something like that, but it is important for adults to do. So that's just a note there, but incorporating humor sometimes into your health education can be effective. Encouraging workers to use the buddy system and be aware of symptoms. And if you see something, or if you notice that somebody's not acting like themselves, or if you think someone is having trouble or is having some health problems, then you should say something to them and maybe report it to the supervisor. And again, supporting each other and asking for drinking water, shade, for rest breaks. And continuing on this notion, no job is worth their life. Giving them the knowledge and the resources that where they can report, or they can go to the authorities if their employer really isn't providing enough drinking water for everybody to get some. Or talking about OSHA, there's no national standard for heat yet, but under the general duty clause, employers have to provide a reasonably safe working environment. So maybe in the future, we might see specific standards. Some states have specific standards about when you have to provide shade and how much water you have to provide. But again, this is tricky to talk to workers about, that no job is worth their life, and to all this stuff, because it raises the question of culture and of their pride, of their health, of their mental health. So again, people in the crowd, in the audience today, they might be mental health professionals, and encouraging. So people who have done this before, they know that encouraging men to talk about their health or to admit that they need a break is not easy by any means. And we don't want to just talk about men here, because again, many female farm workers and female farm workers need to have this information as well. But in the case specifically of men here, it can be difficult. And if people have any specific strategies, again, please share anything that you've done yourself or that you've seen done, talking to workers about health, and because it's kind of a difficult topic to unravel and to know where is the best place to start. To just talk about hydration and the science behind water and salt and everything, and how much hard your body's working. But also, I think it's important to talk about mental health and to encourage workers to have compassion for themselves, encouraging them to think about their long-term health and longevity. Again, like Bethany said, the studies show that chronic kidney disease, men in their 30s and 40s needing to go on dialysis. So just some things to keep in mind of what you can mention to workers. Also, studies show that men are by far are influenced most by their friends or their peers or their coworkers. And so if you convince one guy in a farm worker group to take this stuff seriously and to start valuing break time, then other people don't want to be the first one to do something, but if they see that their friends are doing it, then they may start to remove the shame from it themselves. So another thing, again, specifically talking about men, but also farm workers in general, are incredible athletes. And if you're trying to figure out a way to present this topic to them in a way that they'll receive it and really start to change their minds about the way they think about themselves and their work, is comparing them to professional athletes, the way that they're exerting themselves incredibly hard, being incredibly productive when it's 90, 95 degrees outside under the sun. We know a lot of farm workers like to play soccer. I'm sure people who do farm worker outreach, they see the soccer fields on the side of the housing sites and stuff. So a lot of these guys are literally athletes. They like playing soccer or basketball. We've seen a lot of, but making the comparison to athletes, and then saying something like, would your favorite soccer player practice for hours without taking a break? Or would a coach of a soccer team let his players just keep playing in the last 5 minutes of a game without taking a timeout? No, in sports, people take breaks. People understand that players need rest and time to hydrate to perform their best. So this is something you can mention too for getting farm workers to buy in a little bit more. So on this topic of mental health and talking to farm workers about this and how mental health and people's identities kind of are an important thing to think about with this issue of heat stress and hydration and taking breaks. Bethany will present about these next few slides.
Thanks, Matt. I want to acknowledge there's a very lively chat discussion, and I want to acknowledge that we recognize that there are a lot of complex things happening on farms in terms of the power dynamics, right? We need good legislation to protect workers. We need good enforcement of that legislation. We need employers to do their part. We need labor recruiters and labor contractors to do their part. All of those pieces will certainly support better workplaces for farm workers and enable that, right? If workers aren't worried about losing pay or losing their job to take a break, then they will take breaks when they need to. So we acknowledge that. We have different trainings that we do for employers that talk about some different topics, But this training is really focused on workers because frankly, it takes a long time. It takes a long time to pass policy. It can take a long time to get employers to get on board. And there are things that workers can do to protect themselves because we shouldn't have to wait. And frankly, you know, working so much in the South, I've spent most of my career working in Texas or in the South, and it is very hard to pass policy. Just last week, I spent a year of my life working to pass a rest break ordinance in the city of Dallas so that construction workers could take two breaks a day. And that just got taken down by the governor. So we recognize the importance of good policy and how important it is to advocate and create policy, but we also recognize that there's a reality where policy is not meeting people's needs, and it might take years and years to get it there. So I just wanted to say that before I jump into this conversation that's very focused on workers, because we do acknowledge all of that. Okay, these two slides are a little funny. If you disagree with me, that's totally fine. But what I have learned in years of talking to outdoor workers and training them is that I can say, you need to drink when you're thirsty. You need to listen to your body. But that is not a successful tip for many workers. One, because of the power dynamics that are on farms, but two, and really critically, I think, is because many workers are unable to do that because they've had so much trauma in their lifetime and they've gotten so used to pushing their bodies so hard in order to survive that they really can't listen to their bodies. They don't know when they're thirsty. When they're sick, they're just pushing through it, and they're having a hard time recognizing when they've pushed themselves too far. And this is sad. This is like a systems problem that workers are experiencing, but I bring it up because I think it is really important for a lot of workers that have, you know, experienced trauma in their home country, gone through the trauma of migrating to the US, and are now going through a trauma of being very exploited on a farm. So I think it's a pertinent issue for a lot of workers. And the point that the thing that's happening with many workers is that they're dissociating, which means that you are not connected to the present moment. And this can be like a mental defense mechanism, right? You might zone out, you might be on autopilot, but basically you're not connected to your physical body. And you actually, researchers found that you feel less pain when you're dissociating. So things might be bad for a worker and they may actually not be able to recognize it. And this is really quite common in folks that have survived trauma and have PTSD, which is quite common among farm workers, or complex PTSD. Go ahead, Matt. These are a few techniques. This is not a replacement for changing power structures on farms. That needs to happen. This is not a replacement for professional mental health care for farm workers who need it. And it's critical that we all advocate for mental health resources in addition to advocating for physical health resources. But there's a few tips on this slide to help workers sort of to start, you know, overcoming the dissociating and kind of get back in tune with their bodies so that they are able to more quickly recognize and respond to when they're not feeling well. So there's several on here. One that I like, and I recommend you try them yourself to see which ones you're comfortable telling workers about. But I think a good one is the 5, 4, 3, 2, 1 technique. And you can have workers, you can talk to workers and have them do this when they're feeling a lot of stress, when they feel like they're on autopilot or they're zoning out. And what you do is you take a moment, you look at 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. And that process basically is bringing you back to the present moment and back to what you are experiencing in your body. And that will help workers over time in a subtle way kind of be able to respond to their body's needs more quickly.
Thank you, Bethany. And again, if people have any thoughts on this topic, please say in the chat. We have some questions about the construction industry, regards to heat issues. We can address these later on. Okay, so approaching, that whole section was about approaching workers and how to talk to them, how to, go about the conversations with them. Now it's talking about approaching labor contractors and employers, which is really the key here to changing things on farms. Like Bethany said, the power structures and changing the culture. If the employer or if the crew leader is encouraging workers to take breaks, that goes such a long way. But so what can health outreach staff do, or just outreach staff in general? Offering to help farms develop an emergency plan. This is something that a lot of employers are interested in recently, because there are rumors that the National Department of Labor is going to come out with an official heat stress or heat rule. And so a lot of employers and a lot of groups are preparing for a potential reality where they have to have an official plan in place. And so if we as health outreach staff, if we can reach out to them and offer to help them craft a plan like that, that can be seen as a useful thing from the employer. Encouraging the supervisors and the again, even if you're contacting just a crew leader or supervisor, or if you're contacting someone at a big company in the office or the HR, encouraging them to make water, rest, and shade more accessible. And then, like we already talked about, motivational and educational talks with workers. So talking with employers or labor contractors or supervisors is a big thing, is to focus on positive outcomes. Again, emphasize that there are studies out there that show that more rest breaks and easier access to water makes workers more productive in the short term and long term. People feel better, they feel more valued as human beings. Again, the athlete comparison. It works with workers. Probably going to talk about soccer, most likely, if they're Latino workers. And if you're talking to an employer, same thing. Maybe talk about football if you're in a rural part of the United States and people like American football. Make the athlete comparison, or talking about being a coach, and because there have been examples of high school football players practicing in the sun and getting really injured and even dying over the last 5 or 10 years. People have maybe seen this in the news, but there have been some high profile cases of football teams experiencing some really bad things when they're exerting themselves too hard in the heat. Educating the employers about the physical demands of farm labor, which this we don't want to go to employers being like, telling them something obvious that they already know. People involved in agriculture know that it's a really demanding. People are stooping and bending over and kneeling down. So employers know that it's going to be that it's hard physical work. But here's some statistics that Bethany found, actually, that an adult doing 8 hours of farm work can burn more than 2,500 calories, which is about the same as someone who runs a marathon. There was another study with where Latino farm workers in the Midwest, they were detasseling corn. They were found to be burning between 350 and 540 calories per hour, which again could amount to as much as more than 5,000 calories a day. So using these data to go to an employer and say, look, your workers are basically like marathon runners in terms of how much energy they're expending, and so they need to take breaks, they need rest, they need electrolytes. On-farm health talks. Any advice that I can give from the last 2 years of that I've been doing this work is, again, like I said, focus on positive outcomes, offering to train supervisors. And if you can train supervisors to how to talk about the subject with workers, how to go about initiating rest breaks. And like we said, getting crew leaders and contractors on board is key. Now, a big thing here is talking about the economics. And this is something Bethany and I have talked about a lot, and some of our other colleagues is in an ideal world, talking about shade specifically. Yes.
Hang on, the
Yes.
interpreter lost connection.
Oh,
Ya, sabemos que la intérprete no está conectado. Vamos a esperar un minutito, disculpa. Lisa, has she sent you a text?
No. I haven't heard from her.
All right, Matt, let me make myself interpreter and we can keep going.
okay.
Just give me 1 second. Go slow for me.
Okay. Are you ready, Bethany?
Let me check. ¿Me escuchan en el canal de español?
Sí.
¿Me escuchan? Y no me escuchan en inglés.
We are hearing you in English as well. Bethany.
Okay, 1 second.
Sí.
No, I don't hear you, Bethany. I cannot hear me. Okay, I will continue. So I'll start back here in the slide about focusing on positive outcomes. When we're approaching employers or contractors, the relationship trying to engage employers or contractors can be difficult if we're a worker advocate. The employers might not trust us. Something we can educate the employers about is how much energy workers need. And so there is an interesting study that showed that farm workers in the US were burning almost 540 calories per hour when they were working. And that's about the same as someone who runs a marathon, 26 miles. And so people can use this stat to employers again to make the athlete comparison that the workers here are super athletes. They need proper rest and hydration. So developing relationships with the employers or the contractors to get access to the workers and offering to train the workers. If you focus on positive outcomes, and you can make it so for the employer it's seen as a benefit or as a good thing to train their workers about drinking more water. Also, we help people who are in health outreach can offer to train supervisors, and the employer might like that, the idea of us training supervisors and then supervisors going on to provide that knowledge to workers. So again, emphasize it being collaborative process. It's a win-win for workers and employers. Okay, so now we have some examples for you all. We want you all to participate and to share any ideas you have. So a little quiz or question for you. So scenario 1, what would you do if you and your coworker are visiting farms doing outreach? It's a warm spring day, let's say in April, and your coworker says that she's starting to feel dizzy and lightheaded. What would you do? Anybody feel free to come off mute and share what you would do in this scenario. Is it an emergency? Should
I'll
we just
step
give,
up.
Have
No one else will.
her
I'll
stop
step up.
working and hydrate, drink water or Gatorade or something.
yeah.
Yeah. Get
Absolutely.
her in the shade as well.
Shade, yeah, that'd be a good idea.
And just,
Horas.
and hang out with her till she feels better.
Yes.
Hola, mi
Griselda,
nombre es Nayeli Aguirre, soy de Líderes Campesinos de Kernson. Yo tomaría un descanso, tomaría agua y me sentaría en la sombra.
good idea. Yeah, Griselda, did you have your hand up?
Sí, si es que es una compañera o compañero que tengo al lado, primero haría las preguntas desde cuándo está empezando con estos síntomas, desde cuándo, ¿no? Un ejemplo, si es que puede ser de otra situación, dependiendo de un mini preguntas como evaluación, ya de ahí ofrecer las cosas que necesita, porque qué tal si la persona necesita suero o necesita agua, porque no es igual el agua que el suero, ¿verdad? Dependiendo del nivel de deshidratación que tenga la persona. De ahí, pues obviamente colocarlo en una área de sombra y darle un poco más de asistencia y ver sobre su situación médica también, porque podemos solamente dar algo breve, pero sin embargo, con pequeñas preguntas puedes hacer gran diferencia, porque no todos contamos con una situación, cuestión médica saludable. Hay personas que necesitan un poco más de ciertas líquidos que otras personas que gozan de una salud bien, ¿no? Es todo.
Yes. Thank you, Griselda. So she mentioned something that other people hadn't, which was asking your coworker how long has she had those symptoms? Have you been having these symptoms for a few days now, or did it just start? Which is a good idea because, like Bethany talked about, sometimes heat illnesses can start over a day or 2 or 3. We're going to go on to the next one now. Okay, so another scenario. What would you do if you arrive at a farm around 4 p.m. and there's a worker out there who's stumbling, he can't walk correctly, and his speech is slurred, he's not pronouncing his words correctly, and it's only 87, well, not only, it's 87 degrees outside. What do you do? Yeah, Adeline, I saw Adeline, you had your hand up. Do you want to answer this scenario? Or anyone else? Yes, Elizabeth.
Have him or her go to the medical, to the doctor.
Sí, pídanle a él o a ella que se ponga lo médico, el doctor.
Yep. Yeah, with these symptoms,
Sí, con
stumbling
estos síntomas.
Yep. With these symptoms, it looks like it's an emergency and the worker
Sí,
should go
con
see a
estos
doctor
síntomas
immediately.
parece ser que es una emergencia y el empleado debe de ver a un médico de inmediato.
Yes.
Sí.
Hey, Annette, is the interpreter back now?
Yes, the interpreter is back. Can you
Okay. I think you have to
hear
switch to the,
me?
I think you should switch to the Spanish channel. Or Bethany, you might have to change the interpreter to her.
I cannot can change.
Let me see.
Okay. Los que están escuchando en español, mil disculpas por la interrupción, pero ¿se puede escuchar, Ariane?
Yes, testing. This is a test. Maybe
Ah,
Bethany,
yeah.
you can go on the Spanish channel
Okay.
and make sure the interpreter is working in the Spanish channel.
Sí,
Okay, great.
y sí escuchamos.
Okay, very good. So yes, this scenario of you arrive at a farm at 4 p.m. and a worker is stumbling and slurring their words, and it's only 87 degrees outside, that would be an emergency. You should encourage that worker to go to a doctor. Okay, now any questions from the audience? Please feel free to come off mute and ask a question. Or Bethany, if you can see people who are raising their hands, I can't see.
Yeah, Jesus and Maria.
Maria Rincón.
Sí, muy buenas tardes. Trabajo con Proyecto Mixteco Indígena. Bueno, como yo trabajo en la presa, apenas tengo poquito que trabajo aquí. Nuestro supervisor siempre nos enseñaba que una persona se estuviera sintiendo mal, que íbamos a avisar al mayordomo. Si el mayordomo estaba ocupado atendiendo a la persona, teníamos que llamar a los de emergencia. Pero una persona tenía que ir afuera de la calle donde estamos y en otro adentro para que estuviera pues señalando dónde estaba la persona, porque a veces nos llamamos pues la ambulancia y la ambulancia no sabe dónde llegar. Por eso que tenemos que también dar muy bien la ubicación donde pueden llegar. Y es más pronto que pueden llegar ellos.
Yes, so for people in the English channel, Maria made the point of when people call 911, if there is an emergency, workers need to know what to tell 911 about what their address is. And that's something that NCFH has tried to put into educational materials, is making sure workers know what their address is or how to describe where they are if they have to call 911. So good point, Maria. Jesus Noyola.
Sí, era similar a lo que compartía María Rincón. Son diferentes, pueden ser diferentes escenarios donde hacer preguntas todavía pues dé tiempo a hacerle al compañero o al colega que está al lado de la persona, pero como lo comenta, si ya está tambaleando y no puede hablar, no hay tiempo para andar preguntando al supervisor. Creo que lo más rápido es el 911 a emergencias.
Yep. And Christiane.
Hi, thank you so much for the presentation. I have a couple of questions and one comment, so I'll try to be brief. So the one question is, if we provide employers' names to you, could you make arrangements to provide training to these employers nationwide?
Yeah, we'd be thrilled with that opportunity.
Wonderful. And the second question, it relates to heat stress and possible correlation with heart attacks. Is that something that you have literature about? There are studies about any sort of correlation, but being the main cause, not let's consider somebody who doesn't have any congenital defect in the heart and never had the heart problems, doesn't have high blood pressure, and even go further and say doesn't even have metabolic syndrome. Is it possible that a perfectly healthy person have a heart attack due to heat stress?
Can I take that one, Matt?
Yes, you can.
That is a great question. And I wish we had more information to give you. The place where that is happening and where there's documentation of that happening is in the United Arab Emirates. Yep. And it started coming out during the World Cup stadium construction. Because the UAE has a really similar guest worker system to us. They call it the kafala system, where an employer brings in workers and the workers are tied to that employer. And it's quite, there's a lot of exploitation and bad working conditions. So workers from Nepal were dying at an alarming rate, and many of them from a heart attack from the heat. But the heat there is quite extreme.
Yeah.
So I don't know, you know, we're seeing very extreme temperatures, like on the Texas-Mexico border. The heat index can get up to 130 degrees, which is similar to what it is over there. So I don't know about stuff in the US, but if you Google, you know, look up the UAE and Nepal workers dying from the heat, you'll find a lot of information about that.
Interesting. And I know that there is, you need lower temperatures to have heat stress under humid conditions. And I think that the heat over there is dry, if I'm not mistaken, but the temperatures are in the triple digits. So therefore, you might have the same effect that temperature in the high 80s under high humidity here in the US. Is that correct?
I'm sorry.
Bethany?
Yeah, I didn't fully compute that question.
No, I mean, I've heard that when there is high humidity, you don't need as high temperatures as you might have in the dry heat areas to get heat stroke, heat stress. So I'm wondering, I think that over there they have dry heat, but because the temperatures over there are in the triple digits, it might be the same effect. It might be same correlation of heat stress. And that's very interesting. I'll definitely look it up.
Yeah. Thank you. Good questions and good points.
Thank you.
And Bethany, there's also a question in the chat from Monique about using cooling vests. And Andreas had also asked about cooling towels. Do you know anything about that, Bethany? The efficacy of them?
Yeah, and somebody also asked a question about humidity, which I'll follow up on that first since it touches on the same thing. So the temperature and the humidity level, those combined create the heat index. And the heat index is basically how hot it feels. You can't, I mean, in very high temperatures, it starts to burn off humidity in the air. So once it gets super hot, you just can't have extremely humid conditions. You're not going to have 90% humidity and 110 degrees. But those two things combined will make it feel hotter. And the reason high humidity levels, you know, 70, 80, 90% are dangerous is because it basically hampers our own cooling system, which is sweating. So we sweat, the sweat evaporates, and that cools off our body. And when it's humid, the evaporation isn't happening, or it's not happening as rapidly. So that's why high humidity levels can become dangerous. But there's not like a cutoff point. There is a chart. Honestly, that chart of the humidity index isn't very scientifically based, so I don't share it. But that's basically the relationship there. Cooling vests, they're great. There's a lot of tools like, you know, fans, camelbacks, cooling vests, all of that would be good. I just would caution not to distract, especially an employer, away from the core tenets of workers getting enough rest, getting rest in the shade, and having access to water that's actually drinkable and not, you know, that doesn't taste horrible. So if they're doing those three things and they want to do more, great. But, you know, don't let people think that, oh, I can just give away cooling vests or cooling towels and people will be fine. So you want to make sure they have those three basic things, and then they can go above and beyond. Griselda?
Sí, tengo una pregunta. ¿Tienen materiales en su sitio para poder compartir con la comunidad en los alcances? Aparte del volante que ya nos han compartido, ¿hay más materiales que pudieran agregarlo en el chat, por favor?
So Griselda is asking a great question about if we have more materials on this topic that we could share besides what we already have. No, we don't. We've created, no, but there are others that I can share. I would need a little bit of time to put those together, but we can send those out in the email because there are materials from like University of California, Davis and other great groups that have put together some good information. So we will share that with you guys. There was a comment about construction workers. Yes, somebody asked, is the construction industry any better? I would say no, not really. All those urine samples I took were from construction workers that did a heat stress study last year, and it's pretty bad as well. Edgar?
Hi, just an observation from here from Washington. So one of the ways that, we're trying to pass heat and smoke protections and all these things for farm workers in here in Washington. One of the bigger, kind of more complex things that we've noticed about how state agencies and the industry, agricultural industry, has been using some data to justify their points, which, one of the things that they've been throwing out there about having these like high temperature thresholds for workers to be out working and high air quality index rates out there, is this thing about worker acclimatization, which, we feel that it's a way that they've been using data and science and to benefit themselves and their points, which, is very contrary to like actual like worker health and general population. There's like, it seems like there's two ways that we're told about heat and smoke. Like one is for the general population and then one for farm workers. So, I think that's something important to kind of point out, especially like if we're trying to propose like systemic rules or systemic fixes to a lot of these things. So yeah, there's just a little bit of a perspective here. Anyway, I'd like to hear your thoughts about that too.
Thank you. Yeah, it can be a tough one. And that's why I always share that Cruz Beltran one with employers, because, he was working in Arizona and went to Nebraska. It's way hotter in Arizona. He was acclimatized and he still died because people can get carried away with that point. It's great if workers are acclimatized, but that doesn't make them invincible. So yeah, but people love to use data for to support any argument.
Okay, so speaking of more worker health stuff, the National Institute for Occupational Safety and Health, or NIOSH, they have some criteria for a recommended standard. So you all could Google this, NIOSH heat criteria. I will drop this link in the chat to the flyer that NCFH has. And NCFH's program, some of you all may be familiar with this, but Call for Health is a line that farm workers can use for any sort of health question that they have, not just about heat. This is about general health stuff. It's WhatsApp accessible. Anybody who has WhatsApp can send a message to this number, 737-414-5121. And they can ask anything they need to about getting healthcare in the US, like where the closest migrant health center is, where the closest hospital is, how much would a flu vaccine cost, what should I do if my urine is really brown? Any health question, we run this. So please email me and Bethany if you have more questions about any of this.